I guess, is this working? Yeah, okay. So I've been interested in depression for a long time. In fact, my mentor and predecessor, Jerry Rosenbaum, had noticed that I was particularly interested in this. And so I'm going to tell you a little bit about the tremendous changes that we're seeing in this area. But let me start with, I think one of my favorite quotes, you probably know it by now, is Abraham Lincoln's, that the best way of predicting the future is to actually create it. And so innovation is a way that we can utilize to really change our future. So this year we're celebrating the 90 years of our department. It was founded in 1934. And the first chair of our department was Stanley Cobb, considered one of the fathers of biological psychiatry. And he was a tremendous innovator. In fact, in 1933, two Italian doctors, Celletti and Bini, had discovered that electroconvulsive treatment could treat a number of psychiatric conditions. At that time, it was called shock therapy. Now it's called electroconvulsive treatment, or ECT. But Stanley Cobb published a seminal paper in probably the top medical journal, the New England Journal of Medicine, on shock therapy, and really introduced ECT. And we still have an ECT service at Mass General that really stemmed from his early innovation. In fact, Jerry is the Stanley Cobb professor at Harvard Medical School. So why do we need new treatments for depression? And here is where the encouragement by Jerry to start a program in depression led me to develop a large practice of patients suffering from depression. And I quickly realized that many of the treatments, the standard treatments, were not good enough for my patients. So, in addition, another thing that is very important is that we've seen a tremendous rise in the rates of depression in every younger generation. So you can see that the rates of depression are going up the younger you are. So that means that if we don't do something, right, our grandchildren will have higher rates of depression than our children, and their children will have even higher rates of depression. So we're seeing this escalation of depression. And in fact, during the pandemic, this is work from Roy Perlis from our department, you can see how during the pandemic, the population aged 18 to 24 had much higher rates of depression than adults. And so why aren't we satisfied with standard antidepressants? I think two main reasons. One is that they don't work that well. They're modestly effective, and they're not that fast. This was a study. I had the opportunity of being one of the three principal investigators of the largest clinical trial conducted in depression called STAR-D. And what we found in that trial is that only 1 in 3 patients remitted. So you can see the lower scores indicate that you're not depressed. So 0 to 7, you're not depressed at all. But the majority of these patients, after treatment with a standard antidepressant for 3 months, they continue to have depressive symptoms. And if you look at those that, who went on to remit with the standard antidepressant, which was citalopram or Celexa and STAR-D, half of those remitted between week 6 and 14. So imagine having to wait for 3 months to get better. So what are the novel treatments of depression? Phil actually will be surprised by this, but one of the things that I've investigated quite a bit, and I've started doing that with Jerry early on, is that we all have in our body a substance called acetylmethionine, or SAMe, which is an anti-inflammatory agent. In fact, it's marketed in Europe for arthritis. Well, we studied this compound in depression, and we did a study at MGH, and we found that when people didn't respond to a standard antidepressant, if we gave them SAMe, they had much higher response rates than if we give them placebo. And on January 19th, so a few weeks ago, I got an email from one of my patients and who was not responding to standard therapy. And so I said, why don't we try SAMe? And here's what she said. I started SAMe a month ago. By the way, this patient of mine, who's a professional, has both depression and ADHD. So she said, I started a month ago. It's definitely good for mood and probably ADHD as well. And then she says, maybe SAMe is so good for mood that I'm just not as troubled by the ADHD. Either way, this is very good. So again, the importance of innovating in thinking through. This is a repurposing of a drug for depression. But another example of innovation is an anesthetic drug called ketamine. Now, it was used for many, many years and is still used as an anesthetic. But in the early 2000s, people noticed that one administration of intravenous of ketamine, 0.5 milligram per kilogram, so a dose that could be 40 milligrams IV, produced a very rapid improvement in depression. That is, these patients actually got better in 24 hours. Remember, 3 months, 24 hours, big difference. And this is the study that we've done at MGH, which was a multi-center study that looked at different doses of SAMe, of ketamine, in which we found that 0.5 milligram per kilogram, which is the standard dose used by many ketamine clinics around the country, is in fact the most effective and works in 1 day significantly better than the placebo here, which was midazolam. So this led to J&J developing an intranasal formulation of esketamine. So ketamine is a kind of a racemic compound, comprises 2 forms of esketamine and arketamine, and they developed esketamine intranasally. It's called Spravato. And if you look at the studies that they have conducted, they've shown a clear, robust improvement, again, within 1 day upon administration of esketamine. And it's now approved by the FDA. And at an MGH, we were the first one in the country to have an intranasal ketamine clinic led by Christina Cousin. And now we're about to open up a whole suite for ketamine treatments, both Spravato and intravenous ketamine, thanks to the support of the hospital. I can tell you, no other hospital has been supportive of psychiatry as ours, so we're very fortunate of having the investment of the department to create a large ketamine space for our clinic. And last year, one of our faculty, Amit Anand, published a paper, again, brings me back to Stanley Cobb, who introduced the most effective treatment ever in depression in the United States. And that remained the most effective treatment for 80 years until last year, when Amit Anand showed for the first time that one treatment was actually better than shock therapy or ECT, and that was ketamine. And he published that in the same journal where Stanley Cobb published his paper, the New England Journal of Medicine. Now, the problem is that people say, well, it's intranasal, I don't like it, I have to come in to get it, I don't like the intravenous. Is there anything orally that could give us something like ketamine? And And so I participated in the development of a compound called Auvelity, which is the combination of bupropion and dextromethorphan, which is Robitussin. And again, innovation, led to the development of this product, which was approved by the FDA. And as you can see, the combination of these two compounds is better than bupropion alone, which is an antidepressant. Well, this is an email that I got on January 1st from another patient of mine. Now, she refers to a protocol, but I simply started the Auvelity. So, but she says, I began the protocol on December 3rd. On December 4th, a day later, I experienced an immediate and significant mood change. I felt none of the crippling despair that I had been experiencing for almost 2 years. I had tried many different things, and she wasn't getting better. There was no depression. There was little or no anxiety. I have no side effects. And she remains well. I've talked with her recently. Crystal knows. But so amazing. This is incredible. From 3 months, 1 day. Now, what about psychedelics? Jerry is the director of our Center for the Neuroscience of Psychedelics. You see lots of articles. There's a lot of interest. Probably the most interesting articles published by Guy Goodwin in the New England Journal of Medicine 2 years ago, in which they published the results of a study comparing a low-dose psilocybin to an intermediate dose and a high dose. And as you can see, the high dose, which is 25 milligrams, induced a rapid improvement in depression that was sustained over time. So psychedelics may be another tool for rapid antidepressant effects, but also for sustained effect. And so, in fact, this afternoon I have a call with the FDA about another program that we're working on to develop a psychedelic treatment. So what about other non-pharmacological treatments that we're excited about? Jean Campodron spoke here last year. He's doing an amazing novel protocol that involves 10 sessions of transcranial stimulation in 1 day. And he can get people better in 24 hours, which is incredible, just with the transcranial magnetic stimulation. During the past 2 years, we've established a Center for Digital Mental Health led by Sabina Willem. And our center has developed a number of apps, very much like Taylor has developed, to treat depression, anxiety, OCD. And the one for depression, they just did a trial that showed a lot of promise with this app called Mindset. So we're very excited about that. And then I think you've heard, I'm very excited about the work that Daphne and her group are doing, again, with the at-risk college students. But what about, can we prevent depression when we get older? I remember Jerry's predecessor used to say that wisdom comes with age, but in his case, age came alone. So the important thing is to make sure that with age we don't develop depression. And so Livio Carecchi is a wonderful researcher in our department, has done work to look at vitamin D3 supplementation. As we get older, we get less D3 absorbed. Omega-3, it's very important not to get. Anyway, we're very excited about the work that she's doing to actually help us figure out how to minimize the risk of depression as we get older. So in summary, I think I go back to Abraham Lincoln, The best way of predicting the future for the treatment of depression is to create it. And I feel, and hopefully I gave you a sense, we at MGH are doing exactly that. Thank you very much.